Pancreatic cancer can grow quietly without showing clear signs. By the time you feel something's wrong, it might already be too late. In today's video, we're talking about the early warning signs of pancreatic cancer, a deadly disease that's very hard to catch early. It's the third leading cause of cancer deaths in the US, which makes spotting the signs as early as possible extremely important. The pancreas is a small organ deep inside your belly. It helps with digestion and controls blood sugar. But because it's hidden, pancreatic cancer can grow without clear symptoms until it's too late. That's why many people don't find out until the disease is already advanced. The good news is, some early signs do exist. If we learn to notice them, we may catch it sooner and save lives. In this video, we'll go over these early symptoms, from yellow skin to changes in digestion, and what they mean. We'll also talk about who is most at risk. So, if you care about your health or someone else's, hit that like button, subscribe, and let's get started with the first warning sign. Number 1. Jaundice. One of the first and most clear signs of pancreatic cancer is jaundice. This condition makes your skin and the white part of your eyes turn yellow. This happens because of a buildup of a yellow-brown substance called bilirubin, which is made when the liver breaks down old red blood cells. Normally, bilirubin moves through a tube called the bile duct and leaves the body. But if a tumor in the pancreas blocks this path, bilirubin stays in the blood. This causes the yellow color we see in jaundice. Keep in mind, jaundice can also happen because of other problems like hepatitis or gallstones. But when it's caused by pancreatic cancer, other symptoms usually come with it. Jaundice doesn't always mean cancer, but it does show that something is wrong with your digestion. Finding out early is very important. Don't ignore this change in your body. If you see jaundice, get checked by a doctor right away because your pancreas might be trying to warn you. Number 2. Constant nausea and vomiting. Feeling sick to your stomach and throwing up without any clear reason can be an early sign of pancreatic cancer. These symptoms usually happen because the tumor is affecting how your stomach works. As the tumor grows, it can press on the stomach or small intestine, making it hard for food to pass through. This pressure can cause a partial blockage, which leads to nausea, feeling full quickly, and sometimes vomiting. It's important to know the difference between feeling sick once in a while and feeling sick all the time. A short stomach bug is common, but when nausea and vomiting don't go away and keep getting worse, it could be something more serious. This is especially true if the symptoms happen after eating, mostly after heavy or greasy foods. Many people also lose their appetite or feel full after just a few bites, which can lead to weight loss without trying. Pay close attention if your stomach troubles keep coming back. If you often feel nauseous or vomit, especially with other strange symptoms, talk to your doctor. Your body might be trying to tell you something important. Number 3. Constant itchy skin, also called pruritus. Ongoing itchy skin that won't go away, called pruritus, can be another early warning sign of pancreatic cancer. This is not the usual itch from dry skin or allergies. It's a full-body itch that can be very intense and doesn't get better with creams or lotions. This kind of itching happens when bile salts build up in the skin. Pancreatic cancer can block the bile duct, stopping bile from flowing like it should. When that happens, bile salts end up in your blood and then your skin, which causes strong itching. Sometimes, this itching can show up before other signs like yellowing of the skin, jaundice, so it's a good early clue. The itching is often felt on the palms of your hands or the soles of your feet, but it can also be all over your body. If you notice itching that lasts a long time and nothing seems to help, don't ignore it. While it might be caused by simple things like dry skin, it could also be a sign of something more serious, especially if you have other unusual symptoms. Be sure to let your doctor know. Number 4. Stomach pain. Pain in the stomach area, especially the upper part, can be an early sign of pancreatic cancer. This pain feels different from normal stomach aches. It's often a dull, steady ache that can also spread to your back. Many people say the pain gets worse when they lie down and feels a bit better when they lean forward. That's because the growing tumor puts pressure on nearby organs and nerves. As the tumor grows, the pain may become stronger and more constant. Some describe it as a deep, nagging pain that gets worse after eating, especially after eating fatty foods. This happens because the pancreas releases digestive juices after meals, and a tumor can make this process painful. Of course, stomach pain can happen for many reasons like gas, indigestion, or pancreatitis. But if the pain sticks around, gets worse, or shows up with other strange symptoms, it's important to get checked by a doctor. Number 5. Sudden diabetes. Getting diagnosed with diabetes out of nowhere, especially if you never had it before, could be an early warning sign of pancreatic cancer. That's because the pancreas not only helps with digestion, but it also controls blood sugar by making insulin. When a tumor grows in the pancreas, it can mess with insulin production. This can cause sudden signs of diabetes like feeling very thirsty, needing to pee a lot, blurry vision, and losing weight without trying. Unlike type 2 diabetes that usually comes on slowly due to lifestyle factors, diabetes linked to pancreatic cancer often shows up quickly and gets worse fast. If you've recently been told you have diabetes and it doesn't seem to make sense, especially if you don't have common risk factors, talk to your doctor. Most of the time, it's caused by other things, but it's still smart to ask about more tests. Catching it early can make a big difference. Number 6. Changes in stool and urine color. Changes in your stool and urine can be a clear sign that something is wrong with your pancreas. When pancreatic cancer blocks the bile duct, it can make your urine look darker, like brown or dark yellow. This is because more bilirubin builds up in your blood. At the same time, your stool may look lighter or even grayish because bile isn't reaching your intestines. Bile is what gives stool its normal brown color. Also, because the pancreas helps digest fats, a tumor can cause fat to pass through your system without breaking down. This can lead to oily, floating, and very bad-smelling stool, a condition called steatorrhea. Sometimes, diet or medications can change your stool or urine. But if these changes last a long time, especially if you also have other symptoms, don't ignore them. It's best to get checked by a doctor right away. Number 7. Sudden and unexplained weight loss. Losing a lot of weight without trying is a common early sign of many cancers, including pancreatic cancer. This kind of weight loss happens for no clear reason, not because of a new diet or more exercise, and can be one of the first signs something is wrong. The pancreas helps digest food and absorb nutrients, especially fats. When a tumor is present, it can mess with this process, so your body doesn't get what it needs, even if you're eating normally. Also, cancer cells can use up your body's energy and change how your metabolism works, which leads to more weight loss. If you, or someone you know, is losing weight quickly and without explanation, and it comes with other signs like tiredness or stomach issues, don't wait. This could be your body's way of warning you, and finding out early could save your life. Risk factors for pancreatic cancer. Knowing what increases your chances of getting pancreatic cancer can help you stay alert and take action early. While anyone can get this cancer, some things make it more likely. Number 1. Family history, genetics. If you have close relatives who had pancreatic cancer, your risk is higher. Some people carry certain gene changes, like BRCA1 and BRCA2, that make it more likely they'll get this disease. If these run in your family, talk to your doctor about possible screening. Number 2. Getting older, age. The risk of pancreatic cancer goes up as we age. Most people who get this cancer are over 65. That's why it's important to pay attention to your health as you get older. Number 3. Smoking. Smoking is one of the biggest risk factors that you can control. Smokers are much more likely to get pancreatic cancer than people who don't smoke. The good news? Your risk starts to go down as soon as you quit. This is one more reason to stop smoking if you haven't already. Number 4. Long-term health conditions. People who have had type 2 diabetes for many years or who suffer from chronic pancreatitis are more at risk. If you live with these conditions, it's a good idea to talk to your doctor about regular checkups and healthy lifestyle changes. Number 5. Being overweight, obesity. Carrying extra weight, especially if you don't exercise much, can raise your risk of pancreatic cancer. The best way to lower this risk is to stay active and eat a balanced, healthy diet. Number 6. Chemical exposure. If you work around certain industrial chemicals, like those used in metal or factory work, you may be at greater risk. If that's the case, follow safety rules and use protective gear to limit your exposure. Final thoughts. Just because you have one or more of these risk factors doesn't mean you will get pancreatic cancer. Many of these signs can also come from other, less serious issues. But knowing the risks can help you stay alert. Early detection gives you the best chance at successful treatment. If this video helped you, please hit the like button and subscribe for more health tips that can make a real difference. And don't forget to watch the videos on your screen for more life-saving information. Your support helps us reach more people who need to hear this.